screening, I urge you, I'm a big proponent of proactive and reactive strategies being integrated. Okay? If you're doing diagnostic evaluation types of work, but you don't have a school-wide screening process for behavior problems in place, you're going to be a little bit at a disadvantage. Okay, so I would recommend that one thing you think about for schools in general, not just for kids with ADHD, is to be screening for internalizing and externalizing problems on a regular basis. Using something like the systematic screening for behavior disorders system, or using a broadband behavior rating scale. And again, this, for psychologists, this is a big issue, okay? Because I don't want you to do this if you don't have the capacity to follow up. Okay? That's the sticking point. Okay? The reason it's beneficial here is that rather than being reactive to, I think this kid has ADHD, you can get in front of that and say, every 6 months, we're going to screen for internalizing and externalizing behavior problems and provide some follow-up to do some evaluations with some of those kids, to provide some Tier 2 supports or Tier 1 supports for different types of problems. And the issue that we can address through that, or what we can do a little bit better that way, is we can avoid the confirmatory bias issue of, I think he has ADHD. Okay, and then the next thing that teachers do is they say to a parent, I think you should take your child to see your pediatrician. And then we start going down that road that gets more confirmatory in nature. So here, if we can be proactive, we can do these screenings we can do these screenings, and we can provide appropriate follow-up services if we have the capacity. And what I want you to try to do is to develop the capacity to do that. So, and you can help parents by helping them to understand that as a school-wide service, we're setting up a screening for these types of problems because we're concerned too, and we want to catch these kinds of problems early. And you're also going to benefit the kids at the elementary and middle level for whom we're not finding or we're not catching depression and anxiety or other types of problems early enough to actually intervene effectively. Okay, so there are a lot of reasons to think about screening, okay, but that's one way to think about screening. So school-wide, okay, and so I'm going to organize myself here in terms of, if we're thinking about one particular child, we can also say we're going to use a screening tool. So someone says, I think this child may have attentional problems. Your first response might be to use a broadband behavior rating scale as a screening tool. So you're going to start not just by looking at externalizing problems, or not by using a Connors rating scale focused on attentional problems. You're going to use a broadband scale, okay, because you're going to consider a wide range of issues. So here we're going to answer the question, is further assessment of ADHD or other types of disorders warranted? Okay, so we're not just focused on ADHD. We talked a little bit about screening, but you want to use some kind of broadband scale, okay? I mean, there are other ways to do screenings. You can do screenings by presenting each teacher in your building with a list of descriptions and symptoms of different types of internalizing and externalizing problems, and asking them to rank order the children in their classroom or the children that they work with. And you could do some follow-up with the ones that are highest on the list, depending on the kinds of resources that you have. There are different ways to do screenings, but the reason to use some kind of systematic tool like this, either the BASC or the broadband Connors or something like that, is to help teachers. One of the things that our default screening system in schools is the teachers. Okay? Teachers are great. I love teachers. I want to support teachers. Teachers are not great screening tools for internalizing problems. Okay? Teachers know best attentional problems. And so a lot of things look like attentional problems to teachers. And teachers also can have some biases about kids who are different in a variety of ways. So to rely only on teachers as screening tools is not the best idea. And it's not fair to them, really. But most importantly, it's not fair to the kids. So we want to use some systematic screening if possible, using broadband scales, teacher ratings, or we could do some, also if we're focused on an individual child, we might do some brief interviews with teachers or parents to follow up on some broadband scales as well. Okay? If we're going to do this, if we're pursuing diagnostic evaluations, we want to look at what is the extent and nature of attention-related problems and other problems, what factors seem to maintain those problems, what's the frequency, duration, and intensity of those problems, and in what settings do the behaviors of concern occur. So that gives us a broad perspective. Okay, we want to be thinking about those issues. We're going to use a variety of tools, parent and teacher interviews, using something like a structured or semi-structured interview, like the diagnostic interview for children. I'll show you some examples of that. A review of school records. We're looking for the history and the onset of problems. Okay. With parent and teacher interviews, we're looking for developmental history and onset of problems, as well as looking to see whether problems exist at home and in the community only, in the school only, or in both. So again, this matches up with the diagnostic criteria. We have to have a multiple problem that occurs in more than one setting. We want to use behavior rating scales because they're going to give us normative comparisons. Okay. We want to use observations of school behavior because they're going to help us rule in and rule out that issue of, is this a child problem or is it a school-wide or class-wide problem or a behavior management problem. And we want to look at academic performance data to kind of examine to what extent is the child experiencing not only behavioral difficulties but academic problems, and we want to start to think about what their relationship might be. So with a parent interview, we want to look at current concerns about the child. We want to look at the history of concerns and a review of these different developmental domains. Okay, if we're working with very young children, we might look at something like this tool called the Ages and Stages questionnaire that it goes from birth to age 5. By Bricker and Squires. It's a very nice tool that relates across these different domains that are noted here. So it might be the Ages and Stages questionnaire or other tools that you would use for young children. The Diagnostic Interview schedule for children, the DISC. There's also the DICA. I can't think of the name, the initials, but so Diagnostic Interview schedules for children are what and adolescents are what you're going to want to use. You're going to look at the history of these different concerns and think about current concerns about child functioning. Okay. We'll also want to look at family relationships and family history. So I mentioned earlier parent presence of psychiatric or psychological conditions during school or currently. And then review of parent management tactics. So we want to talk with parents about their approach to behavior management. Okay. Ideally, you want to talk with both parents about that. Okay. As you know, fathers and mothers approach behavior differently oftentimes, and sometimes that difference in approach can be helpful to us because sometimes children behave differently for a mother as compared to a father, or two different parental units, if you will. Okay, and we see that in a variety of different situations or situations such as when parents are not living together and we see children on Monday morning coming into school from one parent's home and they have difficulty transitioning, and when they come from the other parent's home they don't have difficulty transitioning. in part because one place had structure and rules and expectations and the other might not have had that same kind of thing. So we want to think about how parents approach difficult behavior and how they work to prevent problem behavior and what their considerations are for thinking about attentional problems, impulsivity, where they've had success, and those kinds of things. Okay? Always we want to ask about where have you had success? Where does the child not have difficulties? Okay? So as we talk about diagnostic evaluations, we're really kind of focused on where are problems. Okay? However, the key to understanding how to intervene is to understand the comparison of where does the child have difficulty and where does the child do well. Okay? Because our job as interventionists is to make the environment in the place where the child has difficulty more like the place where the child does well, in simple terms. If we can do that, we will be effective. Okay? So understanding where does the child do well is helpful. Okay? Children with ADHD tend to do well when they have more one-to-one or higher ratios of teacher or adult to lower ratios of student to adult attention. They tend to do well with novel stimulus materials or new materials, if you will. They tend to do well when they get lots of feedback of delivered relatively immediately. So they do very poorly with wait till your father gets home and you can earn these points and trade them in 5 days from now. Okay? So we also want to talk with families about family social circumstances. So lots of things can affect kids and their attentional abilities. I already mentioned that. But if we don't have enough food, if we're living in our car, if we don't have a winter coat, I'm going to have difficulty paying attention. Okay, that's sounds silly to even mention it, but we need to be thinking about these things because we're responding to, I think this child has attentional problems. And the likelihood is that yes, they do have attentional problems, but the question is, does that mean they have ADHD? And oftentimes the answer is no. So developmental and medical history, has a child had regular medical checkups? Do they have any types of medical problems that might result in attentional problems? Academic history, family psychiatric history, and prior evaluations. We're going to ask the parents to complete some behavior rating scales, some broadband scales, some narrowband scales, and then some very specific questionnaires. There's something called the Home Situations Questionnaires, which is a nice tool that has some normative data around it, but also gives us some baseline data for looking at the effects of intervention. So we can look at, I believe there's 9 situations that parents are asked to rate, and we can look at reductions over time in the number of situations that are difficult, as well as reductions in the ratings of those difficulties. And then these other measures are going to help us to have normative data to compare symptoms relative to similar children developmentally. We're going to parallel that structure with teachers. So we already talked about broadband measures. We're now going to use narrowband measures. If in our broadband measures we had concerns about attentional problems, something like the ADHD rating scale 4 or the ADIS, we're going to use the School Situations Questionnaire, which parallels the Home Situations Questionnaire. And we might use something like the Academic Performance Rating Scale or the Social Skills Rating System to complement those. Okay? So the first 2 are going to be for diagnostic purposes, and the bottom 2 are going to be more for intervention planning purposes. Okay? So we want to be working in concert with ourselves. We don't want to only be focused diagnostically, and that's what I mean by being purpose-based. We want to think about these different purposes: screening, diagnostic evaluation, intervention planning, and we want to try, if we can connect them, that would be the best situation, rather than have them be completely separate entities. Okay, so we're going to use teacher rating scales that parallel the parent rating scales that we've identified. And then also some self-report rating scales. And again, these sometimes are the most challenging with younger children, especially. As I mentioned, they tend to be not accurate evaluators of their own behavior. But it provides an opportunity for us to talk with children, to get some of their perspective about how they're doing. And we can use things like the Diagnostic Interview schedule for children. The BASC has a self-report measure, the Youth Self-Report of the Child Behavior Checklist. And we can also walk through the internalizing types of problems relating to the Child Depression Inventory or the Reynolds Adolescent Depression Scale and those kinds of things. Those would be particularly useful with middle and high school students, to talk with them about symptoms of anxiety and depression in particular. Okay. Oh, and also we can think about using reinforcement surveys. So what kinds of things, if you want to broaden out this idea of reinforcement surveys, I mean, what kinds of things are reinforcing to you? But even before you get to that, what kinds of things do you like to do? Where are you successful? Okay. If you were working to earn some points that would be traded in for some special activities or things that you'd like to do, what would they be? Okay. It's important to understand those things. What's motivating to these students? What do they enjoy? It's also, if you step back to the family kind of thing, what kind of things do they do together? Okay. So I like to start a parent interview and a family interview by talking about the family schedule. What do you do together during the day? What do you do together during the weekdays? Okay, before school, after school, dinner time, in the evenings. What are your weekends like? What are special family activities? Whether it's bowling, movie night, camping, going to church together, whatever it is, it's important for me to know that and to talk about how does your child do in those situations. What works well, what's challenging? How do you manage those situations? Those are going to be places that are critical for me and for us to connect to, because they're meaningful to families in addition to the meaningfulness of school. So we not only want the child to be doing well at school, but also in the context of their family and community activities.